All right, welcome everybody. Looks like we have just one non-advisory council member in attendance. Welcome, Travis. Kick it off. There we go.
All right.
I'll give one last check over here, make sure nobody's here, but
Okay. Sounds good. All right. Well, thanks for coming, everyone. Happy Monday. So as you'll probably notice, we did not send out an agenda for today's meeting, and that's because we didn't really have any agenda items. The only thing that I wanted to go for today with the council was just all of the terms and definitions that were emailed out on the 15th of March. And so everyone that's in this room has a copy of that. If folks online want to bring up a copy from their email that was brought up on or sent out, on March 15th, that's fine. We're also going to share this same document on the screen here shortly.
And Kathy, just so you know, we cannot start our video, so you can't. I don't think you guys can see us.
Okay.
Just so you know, I don't care. You don't have to see me.
Okay, thanks for the heads up, John.
all right. Can everybody see the draft terms and definitions page?
Yes.
Excellent. Good.
Okay, great. So yeah, basically, I just wanted one last time with everybody following along to go through these terms and definitions line by line as a last once through, really. And so if we could be mindful of even just grammar, right? Because the placement of a comma can definitely change the meanings of things. And so go through this with a mindful eye for grammar and a mindful eye for substance as well, and have any discussion on this. And then really that's the only action item I had for today. If anyone would like to bring up any other topic, you're free to do so at the end. And then at the conclusion of this, barring any objection, I think we'll put to a vote whether or not we need to keep holding these monthly meetings, and just keep corresponding through email as necessary. So keep that in mind. And with that, we'll just start right off and start looking at our terms.
As a heads up, our last two just joined as well, so just promoting them now. All right, look at that. We have everybody.
Okay, great.
Perfect.
So just for the last two folks that came on, just a quick recap here. Plan for today is to go over the terms and definitions line by line to get some group consensus here on the terms and definitions, and then go from there. Okay, so we'll just start off with the very first one there, synthetic cannabinoids or synthetically derived cannabinoids. And I guess I'll just read the first line, and we, like I said, go through this line by line, hash it out. If anyone has any concerns, then please let us know. So synthetic cannabinoids or synthetically derived cannabinoids means a chemical substance that is created through a chemical synthesis, reaction, or conversion by human agency that changes the molecular structure of any chemical substance, including those derived from the plant cannabis family Cannabaceae. Does anyone have anything?
I have a quick comment. I liked the Crime Lab's comment maybe on the first line to clarify, because they argued that maybe chemical substance is too broad if we were just to put in there cannabinoid. So a synthetic cannabinoid or synthetically derived cannabinoids means a cannabinoid that is created through a chemical synthesis, etc. And then we narrowed it down because they were arguing if you just put chemical substance in there, are we talking about theoretically? I mean, it's to some extent it's clear we're not just talking about any chemical substance. At the same rate, I can see maybe there'd be people will try and stretch that.
Yeah, I think that is a valid update, and we're speaking about cannabinoids specifically anyways. And so I think narrowing it down isn't a bad decision there.
And I think cannabinoids there would be, that would cover what I think what we're with.
And the one comment I had was on taxonomy. That was something that we talked about last meeting, and I'm wondering if maybe John Spear has anything to add there as far as making sure we use the correct taxonomy here.
Oh. Mute. Oh, there we go. Can you hear me?
Yes.
Oh, okay. Sorry, I was very deep in that definitions there. I did find a little bit about the botanical term or taxonomy, and we have cannabis family, Cannabinoid. It looks like there's not really a clear standard from what I could find, but people do use, depending on the context, different terms. I've seen cannabis sativa L, but I think with rules related to synthetic cannabinoids, I believe, but I'm not sure. I think that's a little too narrow. So I put in my report, my draft report, I put in a couple terms. If I'm recalling correctly, it was cannabis L was one. And then you could do cannabis SPP period, which would include, multiple species as well. So, we've got some options there.
And I think it's worth pointing out that the definition of hemp out of the Department of Ag uses cannabis sativa L.
Okay. That might be where I've seen it as well. Yeah. Mm-hmm.
Yeah. So, instead of doing the cannabis family Cannabaceae, would it be advisable to do cannabis sativa L?
Yeah, I will admit, not a botanist or taxonomist, so I would say, from what I read, that's been misused to just mean cannabis sativa as opposed to cannabis indica. So it might be safer to use something like cannabis SPP period, if that's what we mean, like all species. Because Cannabinoid, I think, could possibly mean maybe hops.
Yeah, I see what
Is
you're
that-
saying. Yeah, and I'm not sure. Also, personally, not a botanist, but it's definitely something to look into and make sure that we're casting a wide enough net.
Yeah, agreed. And I've got, I'm working off the American Herbal Pharmacopoeia's definition. They have a nice little discussion in their monograph for cannabis inflorescence, and they use the term, cannabis inflorescence means like, the aerial floral part of the plants, and they use cannabis SPP period, cannabis inflorescence, cannabis SPP. So that would cover, are we going to cover, fiber hemp? Because I'm not sure how that gets included botanically.
Yeah,
botanical nomenclature, they use cannabis L, and it says includes cannabis sativa and cannabis indica. Botanical family, they say Cannabinoid, and but then further they define that as including hops. So anyway, that's why I kind of went with the cannabis L, or the you could go pharmacopoeially cannabis inflorescencia. That was the other one I recommended in my report.
Okay.
And that's like, generally you know, cannabis that flowers. I would stick my neck out slightly. Again, not being a botanist.
Yeah, that's great. Thank you, John. I'll have to kind of do some more research in that regard myself.
Okay.
So we'll just leave that open-ended. That'll be an easy one to mop up via email correspondence. And then anytime that we're talking about cannabis, we'll just need to make sure that we insert whatever nomenclature we decide to use there. Okay, so then for the rest of the definition for synthetic cannabinoids, it's broken up into 3 sections. What the term does not include, what the term does include, and what the term may include. And so we'll go to sub A, synthetic cannabinoids. The term does not include natural cannabinoids or naturally occurring cannabinoids. And the term does not include cannabinoids produced by the decarboxylation of natural acidic cannabinoids without the use of a chemical catalyst.
Do we need the redundancy of natural cannabinoids and naturally occurring cannabinoids?
Yeah, so, and I guess that same question could also be applied to synthetic cannabinoids or synthetic derived cannabinoids. I'm happy to hear it either way.
I think naturally occurring cannabinoids cases them all, but somebody has a different.
Yeah, I'm fine with sticking. If I had to choose between the two, I think I'd rather choose the longer version, the naturally occurring cannabinoids, even though it's more of a mouthful to say.
Sorry, point of order. I just noticed, Tony, you're kind of off camera. I'm gonna consolidate this chair. We can get rid of that one. And I just scoot up just a little bit.
Does anyone
There we
else
go.
have
Now
a?
there's not just a voice coming from the void. Thank you.
Does anyone else have comments on using, keeping both of those terms or just using one? I know in rule occasionally we'll use something like that, a shortened version and a long version.
I guess I was kind of leaning towards keeping them both, but yeah. I'm not don't have a strong opinion about it, I guess.
It's something, I can bring that to our legal department and see, when we're drafting rules, why they choose to do that sometimes.
Mm-hmm.
Well, this is Isaac. I have a question about that. So because we have conversion by human agency. So if you leave the term natural cannabinoid, will there be someone who might argue that even though they've hybridized it, altered it in some way, shape, or form, they haven't used chemicals, so they're still using natural materials? Would they be able to argue that anything they've done, provided it didn't include chemicals or other synthetic means, that it's still a natural cannabinoid, even though it might be naturally occurring?
Are you talking about like genetically modified, perhaps, cannabinoid or cannabis plants?
Yeah, some way, shape, or form that they've altered it, even
Uh-huh.
through human agency, but not necessarily chemically derived.
Yeah.
Yes, so there are, lots of breeding programs out there for cannabis trying to up one cannabinoid's concentration versus others. So, that's CBG is a good one, and there's a couple others where people through breeding are trying to do that, and those would technically fall under natural cannabinoid, yes. And further down, we do go on to define natural cannabinoid or naturally occurring cannabinoid.
you could say phytocannabinoids, because I think that will specify plant specific. It adds a little more specificity. Not sure it addresses Tony's question.
Yeah, that's a good point. Phytocannabinoid is a pretty well known and recognized term, and from my seat, I think means the same thing.
And could we add maybe under, so as far as synthetic cannabinoids go, the term does include, add another bullet saying the term does include cannabinoids coming from genetically modified cannabis plants, something like that. Because that's going to happen. If that, I mean, it looks like there could be a loophole there.
Yeah, so we could potentially, if we scroll down to 4 under natural cannabinoids, we could add the phytocannabinoid language there, and also some language that includes a genetically modified or plant that went through a breeding program to get that. So why don't we revisit this topic when we get down to 4, which is natural cannabinoids.
Okay.
So basically here in sub A, the term does not include natural cannabinoids, right? So that's drawing a line in the sand saying there's a synthetic cannabinoid bucket and a natural cannabinoid bucket. And then sub AII, cannabinoids produced by the decarboxylation of natural acidic cannabinoids without the use of a chemical catalyst. Any issues with that? Okay, so now we'll go down to sub B. Synthetic cannabinoids. The term does not include cannabinoids produced by the decarboxylation of synthetic acidic cannabinoids with or without the use of a chemical catalyst, and cannabinoids produced by the decarboxylation of natural acidic cannabinoids with the use of a chemical catalyst. So I wanted to be very clear here that just because you have an acidic synthetic cannabinoid, just because you decarboxylate it, doesn't somehow make it natural. And I also think it's important to use the with or without the use of the chemical catalyst. So no matter what, if you're using light, if you're using heat, or even if you're using chemicals, a synthetic cannabinoid will always be a synthetic cannabinoid. But then the other part here, part BII, when you have a natural acidic cannabinoid and you use chemical reagents as a catalyst, then that natural cannabinoid becomes synthetic. And so none of this should really affect our marijuana industry, because decarboxylation in our industry doesn't use a chemical catalyst. It's using heat. And so the way I read this should be maintaining the status quo of our marijuana industry. All right, so hearing no comments there, we'll move on to part C. And so when we talked about this in the meeting, the may or may not, I agree, was weird. And so before I sent this out, I struck through that language to just may, which makes a lot more sense. So I'll just read part C. Synthetic cannabinoids. The term may include intoxicating or non-intoxicating cannabinoids and cannabinoids with a naturally occurring equivalent. And so basically this is just putting down into words that, hey, you know, you may have a synthetic cannabinoid that has a natural equivalent, which we all know to be true. And also identifying that, you know, some of these synthetics that we are seeing are actually non-intoxicating.
Should this also include, you know, cannabinoids yet to be determined as intoxicating or non-intoxicating?
Yeah, I think that's a great addition. That really kind of is a nod to the novelty of the industry, for sure. And, you know, just the fact that research is catching up constantly with all these new cannabinoids.
Yes. And there isn't, I think I had that comment in my report that I think there's a lot of data out there about, you know, intoxicating or not, but certainly not every single compound or possible compound yet to be determined has been researched for intoxication.
Mm-hmm. That line there, John, also might be a good one to insert into the language for natural cannabinoids as well. So you'll see that natural cannabinoids and synthetic cannabinoids, the definitions mirror each other. They're equal but opposite. So with that one might make sense to put into natural cannabinoids. But again, we'll visit that when we get there. I'll just leave a note for myself to bring that up.
Yeah.
Okay, so that's synthetic cannabinoids. How do we feel about this?
I think we're closing in. Looks pretty good.
Okay, great. So we'll move on to the next one, and you know, obviously the report's not written yet, so none of this is set in stone. So you know, if you go home and this is on your mind late at night and you come up with some great idea, just feel free to pass it along. Oh, and I guess we should also note that the ARN in bold at the beginning of this definition, that was a note to indicate that this is a administrative rule definition recommendation. MCA would be Montana Code Annotated, and so anytime you see that in front of a definition in bold, that would be a recommendation for statute. Okay, so we'll move on to 2, and we've talked about this a bunch. I don't foresee having any extended discussion on this, but basically putting forth a recommendation for the term synthetic cannabinoid product and, excuse me, the term synthetic marijuana product and amending that to synthetic cannabinoid product. Like we've already discussed, just because it better identifies the product. You know, these synthetics that we're looking at are not sourced from marijuana, they're actually sourced from hemp. And so calling it a synthetic marijuana product doesn't actually identify what the product is. And so amending it to synthetic cannabinoid product means consumer products that contain synthetic cannabinoids. So very simple definition, but just slight altercation to, or slight alter to make it actually tell you what it's getting made or what type of product it is. Any comments there?
Looks good.
Great.
Looks good.
All right, so number 3, this is another administrative rule recommendation. So this is kind of the linchpin of everything, right? This is defining chemical synthesis. So I'll just read this out loud. Chemical synthesis means a chemical or artificial substance created through a chemical reaction or conversion by human agency involving the use of chemicals and reagents as inputs to reach a desired output, as opposed to those of natural origin.
I would suggest maybe crossing out chemical or artificial, the top line, just saying chemical synthesis means a substance created through a chemical reaction to simplify it. But
Does anyone have any comments on that?
I think that makes sense.
Okay.
Sounds good.
Yeah, I think that's a fine edit as well. So I'll strike through that. So we'll remove chemical or artificial. It's kind of a mouthful. I think including the human agency part is important because otherwise these substances wouldn't be made. And then part A here, so chemical synthesis, the term does not include the decarboxylation of acidic natural cannabinoids without the use of a chemical catalyst. So being very clear to the established marijuana industry that decarboxylation is fine. It is not considered a chemical synthesis. So that's in writing that, converting your delta-9 THCA to delta-9 THC is an allowable process. And then part B, chemical synthesis, the term does not include, the term does include the decarboxylation of synthetic acidic cannabinoids with or without the use of a chemical catalyst, and the decarboxylation of natural acidic cannabinoids with the use of a chemical catalyst. So a lot of this language is kind of repeating itself within these definitions, but they all match and work well. Nothing's conflicting here. Is there anything else to add? Any comments? Okay, well, we'll move on to natural cannabinoids then. So part 4. Andrew, can you scroll down just a little bit more? It goes on to the second page too. Perfect, thank you. Okay, natural cannabinoids. So I left a note here to say that this could be in rule or statute. And so maybe once we're done reading through this, we could gauge people and see where they think this might be appropriate. So natural cannabinoids or naturally occurring cannabinoids means a naturally occurring chemical substance present naturally in the biomass of the plant cannabis from Cannabaceae, which are separated by a chemical or mechanical extraction process directly from the biomass.
I probably recommend, instead of saying which are separated, putting probably a period after Cannabaceae and saying these may be separated by chemical or mechanical extraction process, instead of saying which are separated. Because I don't think they are necessarily separated by chemical.
Yeah, I think that is a good change in language. It casts a wider net. So should there be some other process that someone might try and argue, it would still be captured under the definition.
capture flower too. Just as a whole in there.
Mhm. And then, so now that we've adjusted things, some of these other definitions, now I'm wondering if maybe we should remove the word chemical from means a naturally occurring chemical and just go naturally occurring substance
I
or
like that.
cannabinoid.
Mhm. A naturally occurring cannabinoid. Yeah.
Yep. So coming back to that term phytocannabinoid, we may be able to integrate that as part of this definition.
Mm.
And it could just simply be at the end of the definition that said something like, I don't know, phytocannabinoids are synonymous with natural cannabinoids, or something a little more eloquent than that. Does anyone in their understanding of these terms think that someone could define a natural cannabinoid different than a phytocannabinoid?
That's a good question. I think I'm gonna just digest this one, but I think it's a good start. And I think Yona's point about just that putting a period after the cannabis family and, you know, making sure we specify the, you know, botanical identity we want there. But yeah, you know, putting in a statement about how you can further purify, you know, natural cannabinoids from the plant material. Something to that effect.
I guess in that thread, you could go separated and or further purified.
Yeah, something like that.
Okay, great. Those are all great suggestions. So let's move on to sub A. Natural cannabinoids. The term does not include synthetic cannabinoids or synthetically derived cannabinoids. The term does not include cannabinoids produced by the decarboxylation of synthetic acidic cannabinoids with or without the use of chemical catalysts. The term does not include cannabinoids produced by the decarboxylation of natural acidic cannabinoids with the use of a chemical catalyst. Okay. So it's a lot of the same stuff we're talking about. It's just same but opposite now that we're talking about natural. So now we'll go to what the term does include. So natural cannabinoids. The term does include cannabinoids produced by the decarboxylation of natural acidic cannabinoids without the use of a chemical catalyst. So again, a nod to the the marijuana industry saying the decarboxylation of a natural acidic cannabinoid without the use of a chemical catalyst is still considered a natural cannabinoid. All right, and then sub C, the term may include intoxicating or non-intoxicating cannabinoids. The term may include cannabinoids with a synthetic equivalent. Again, they're identifying that you can have a cannabinoid that is synthetic or naturally derived. And then I had this note again to bring in, may include cannabinoids yet to be determined by cannabinoids intoxicating effects that are yet to be determined. That might not make quite as much sense under natural cannabinoid. Any discussion there? Okay, hearing none, we'll move on. And so just like with synthetic products, or excuse me, synthetic cannabinoids and how we defined a synthetic cannabinoid product, here we do the same thing where we have natural cannabinoids and natural cannabinoid product. And it's basically just a mirror image, but opposite of the synthetic version. So natural cannabinoid product means consumer products that contain only natural cannabinoids.
We want to put occurring in for consistency.
Did we do that on the first one?
That was our discussion, natural cannabinoids are naturally occurring.
Yep.
Phytocannabinoids.
And then we moved on to basically the products that are formulated with them. And so when we define synthetic cannabinoid product, we didn't say a synthetic occurring cannabinoid product. So again, I will bring this question to our legal department, do the rule drafting and see what they have to say there.
From a legal standpoint as well, I don't know if someone would try to make a deal out of it, but if we're going to say that natural cannabinoid products only contain natural cannabinoids, what about any kind of additives or anything that might be in there, any flavorings, anything like that, that might knock some products out of that definition?
Yeah, so how do you structure this so that
maybe say that it cannot contain any synthetic cannabinoids, as opposed to saying it can only contain natural?
Or what if you say, if you take the only out, means that consumer products that contain natural cannabinoids?
Yeah. So otherwise flavorings and colors or.
Yep, that would be technically could be excluded, or you could remove only and then also add something like and does not include synthetic cannabinoids. Yeah, and so the minute you add if you have natural cannabinoids and synthetics, it just defaults to synthetic. Is there any far-reaching implications to hemp maybe that we're not seeing right here?
I didn't catch anything, at least not yet.
Okay. All right, so let's move on to 6. So this is defining decarboxylation. So we use that term a lot in the other definitions, and so defining it here, I kind of provided two versions that are similar here. I'll just read the first one. So decarboxylation means the conversion of an acidic cannabinoid into its neutral form, typically with the use of thermal energy, such as the conversion of delta-9 THCA into delta-9 THC with heat. Or decarboxylation means a reaction that removes a carboxyl group and releases a carbon dioxide, such as the conversion of an acidic cannabinoid into its neutral form, i.e. the conversion of delta-9 THCA into delta-9 THC using heat. So similar definitions. One is a little more technical. Do folks have a preference of one or the other, or maybe a hybrid version?
Well, I kind of like the first one, but I wonder if we should include decarboxylation in the cannabinoid industry means blah, blah, blah. Just to kind of
Yeah.
narrow it down, because I think I read somebody made a comment like that there's more to decarboxylation and just that what we wrote down there. But if we narrow it down to the cannabinoid industry, it's kind of putting it in its place.
Yeah, I personally like that addition. It narrows it down to the cannabinoid space. Because I thought about that a lot because decarboxylation reactions exist all over in chemistry, not just cannabis, and so I think it would be prudent to narrow it down to cannabis only, and that way we're only talking about cannabinoids.
Mhm.
And either way, either one of these definitions, it clearly states that, again, maintaining our marijuana industry and saying that, yes, this decarboxylation of delta-9 THCA into THC is permissible.
At the end of both, there's an example. It's the first time we've seen an example in these definitions. It certainly helps me, being not a scientist like the rest of you, but I'm just worth noting it's the only time we have an example that's been added to kind of show things work.
So I kind of lean towards the first the first definition as a little more general. The language is more ordinary and easier to understand, which is what you're supposed to do with rule writing. It should be understandable by the reader. I think the second one gets a little more technical, using words like carboxyl group and carbon dioxide.
I was going to say, I am a fan of adding a little bit of chemistry language there to specify, the removal of a carboxyl group, which is redundant given that's what the definition is, but I think it's worth throwing it in there. I won't hold out for, like an actual reaction mechanism.
So there may be some way to put that specific couple of words into the top definition there with some commas. I can work on that and see if I can come up with something that makes sense and isn't too difficult. Okay, so not hearing anything there, we'll go on to the very last definition, which is manufacturing. And this one hasn't changed at all since it was first brought up by John. I admittedly still have to check with our folks here at CCD to make sure that this doesn't interfere with some of the other manufacturing type definitions that we have. And go from there. Does anyone have anything to add to that? It's a pretty long, extensive definition.
Kathy, I might be missing it, but the quotation mark that is in front of the, where the production is, I don't know if there's another close of that quotation mark. I don't know if that quotation mark needs to be there.
Oh, yep, you're right. That was probably me copying, pasting, and missing the other quote. But yep, it should be removed. The only quote really should be around manufacturing. Thank you. I will delete that out. Okay, well, those are the definitions. Like I said, if this stuff is keeping you up at night and you come up with a great solution, please email me and I will distribute that to everyone for discussion. I think these are a really good start to some definitions, and a lot of them are kind of hybrid of what other states have done, and then with some AFDO language tossed in. And so I do think that these are a really wonderful start. But like I said, it's not set in stone yet. So if you have some other comments, there's still definitely time to do that. So I'll save the edits here and put together another draft of this after we've discussed today and send that out for another review from you guys via email. And is there any other items or discussion that people would like to talk about in regards to synthetic cannabinoids while we're all as a group? Did we miss anything? Does anybody have any other comments they'd like to discuss?
Can you remind us on the timelines again, just as we realize?
Yes, so the only timeline that we have is this report, and it is due September
15th, I want to say.
15th?
I'll double check.
Okay. Yeah, so it's due in September. However, I feel like, well, first off, maybe what we should discuss is, do you think we need to keep meeting on a monthly cadence like this? I kind of feel like we're coming to a natural conclusion to these meetings, and we can achieve everything we need to via email correspondence from here out. Okay, does anyone object to that?
I don't object to the meeting, but we haven't addressed the second line item, which is the guidelines.
Sorry. So before we move on, is there any objection to no longer having monthly meetings? Okay, hearing none. Great. And then Eric, you had a question on this part 2.
Right, we haven't made a formal decision on item number 2. And if we decide that we need to provide guidelines, I would think we would need to have monthly meetings.
So for sub B, is that what recommendations on potential guidelines for safe
Yes.
methods of manufacture, extracting, and synthesizing cannabinoids, including the sales of synthetic marijuana products.
Right.
So after discussion with Marcy, I believe it was Jennifer, I feel the only recommendation we can put forth is that if you want to bring a synthetic cannabinoid to market, it has to go through FDA, because we've determined through that conversation that all of these cannabinoids that we're talking about are listed on the Controlled Substances Act, and they are Schedule 1.
Is it marijuana also listed?
Yes, but we have a specific carve out under MARTA specifically for marijuana.
Right.
So there's no specific carve out for anything else that falls under marijuana except for that.
Except for my argument would be the legislatures in 948 specifically are asking to look into the possibility of doing that. So to say that there's not a carve out yet, because they're just now going to start looking at it is redundant. The lawmakers have a right to explore whether they want to do it or not. I'm not sure we should say that we can't give them guidance because right now they haven't made that decision. It's kind of backwards. How can they make an informed decision of whether they want to continue with what they've already told us to do if we're just going to simply say it's already illegal?
Does anyone else have comments on this? You know, they're controlled substances. I'm not even quite sure how to.
Well, that exact argument would have held one day before they legalized marijuana, was that they shouldn't even be exploring marijuana because it's illegal, but they decided, the lawmakers decided they have the authority to make a carve out. So would they not also have the authority to make this carve out if they chose to?
You probably could make an argument. I mean, synthetic cannabinoids is a much wider, larger, undefined group to some extent, and there's hundreds of them there. So it's like you have to individually specify. You cannot just make a blanket statement for it that includes all synthetic cannabinoids. So we're advising not to pursue that or whatever.
Yeah, and my worry is synthetic cannabinoids is a game of whack-a-mole.
They aren't asking us to give them guidelines to find a way to legalize all synthetic cannabinoids. I'm just reading their language, not what we're interpreting them saying.
On potential, there
Potential guidelines.
are recommendations, and it's a recommendation. So it's not like we can give them a recommendation.
Would your potential guidelines be something different than what the FDA puts forth?
Certainly. Yes. Because the state lawmakers, in my mind, have already decided that the FDA framework is not required to be followed for marijuana. Therefore, there would be no reason to assume that we have to have a higher standard for a different but very similar product.
I would almost argue that you do have to have a higher standard, though, because the process of extracting and concentrating natural cannabinoids is a well-known science, well-studied. People do that for essential oils, anything you can think of. All of that is a natural product. But as soon as you cross the line into synthetics, it's different. So I don't think you can compare marijuana to synthetics at this, one-to-one. They're not the same. That's not an apples to apples comparison.
What about the extraction of hemp, which is currently a legal product? If they extract it and make any change to it, you're saying that by definition is a synthetic cannabinoid and can just not be touched.
The extraction of hemp for what?
To get the natural cannabinoids that are already in there. And then if they make one minor change to something, that doesn't mean that they're making everything from scratch. There are safe ways, I would imagine, when we do research on it, that there are some avenues where some of this could be legal and safe. Not everything for sure, but there certainly could be potential guidelines for specific instances where processing would be safe and legal and allowed.
Yeah,
And the lawmakers may choose to go that route.
That goes back to the natural versus synthetics, because people already can take hemp and make CBD. That's a natural process.
Can you take CBD and convert it simply into another cannabinoid? Right now, that would be illegal if we're not even going to consider it. Yet there's no reason to suppose that that might be as dangerous as making an exotic cannabinoid completely from a list of chemicals. Conversions are also done on a daily basis on products that we all consume. Deriving a cannabinoid completely from scratch from chemicals might be different, and we might not ever be able to find a way to regulate that. But making a simple conversion of a naturally occurring cannabinoid does not have to be a dangerous, difficult chemical process.
But we won't know. We won't know until we do our proper validation on that. So
that's exactly my point. We're saying we don't. Right now, it seems like the consensus is we don't want to even look into it. We're just going to stop.
And
we're confusing it here because Schedule 1 doesn't mean that no one can have it. Schedule 1 means that it has to go through the proper research channels, and those researchers are able to do it. So we're not saying that it can't be done. We're not saying that research can't be done on it. What we're trying, I think what we're, at least from a pharmacy guy, what we're saying is that until the research is done, we're not comfortable stating these are the safe processes in which we can do it. So until it's published in research, this is what's going to happen. This is what could happen. This is what happened when we did it. We're not comfortable telling our legislature, this is what we think is safe and can go out to the public.
Could that be a recommendation? Just in those words?
Don't quote me.
No, but you know what I'm saying is that we're saying we simply don't know and we're uncomfortable now. But
But I think what
to
our
react to your
sheriff-
point is there's a possibility that is possible somewhere out there, right? I don't know exactly how I word that, but you see what I'm saying? Where
I guess my general uncomfortableness is not whether synthetic should be allowed, but it's our entire legislative branch and the governor signed this and told us to do it. I have difficulty just saying, we don't think we can do it. And we're not even gonna really look into it because we don't think there's a good path.
So
That seems rough to me.
yeah, let me add here that we're talking about 4B. Up in 4, you know, it's saying we shall review this, including but not limited to, and then B. So in my mind, this conversation that we're having right here is a perfect narrative that goes in the report. I mean, it's recommendations on potential guidelines rather than directives. So, you know, a narrative that says there are potentially ways to safely manufacture certain chemicals that we know about. There are also potentially unsafe methods. You know, I think including both sides of the coin would be key there. And then also, you know, making a recommendation on what would it take if the legislature wants to move forward and allow businesses to follow these potentially safe manufacturing, extracting, and synthesizing methods. What would the legislature need to put in place to ensure that that's actually happening? So what regulation would also need to be in place? And that broader narrative, I think, is good fodder for an eventual report.
I like the way you worded that. I like the way you worded that. Absolutely positively hear your point. Absolutely.
And I think what's still a little missing there is if we're just gonna zoom in on the safety of the actual method. I think we need to make clear as well that we're not saying anything about the safety of the chemical that we're creating. Because our methods can be safe and all, but we might be creating any of these cannabinoids out there. We're still not 100% sure how safe they are for human health.
I think that's a very valid point, Yona, because sure, you can make any compound synthetically under the sun. Whether or not it is safe for human consumption is a completely different thing. And that's the FDA, right? That is them making sure that whatever you synthesize is safe for humans. And so sure, you can make anything with whatever chemicals and bring it to a certain purity, but should you? Is it good for human consumption?
Yes.
And this space is so new and gray that we just don't know. It's far outpacing regulation, admittedly.
Yeah.
You know, that's the whole reason the FDA exists, right? Is to make sure that these products that are coming out are safe for people. And so you might even be able to go so far as your safe method should include a safe product.
Mm-hmm.
So can you really put forth a safe method for manufacturing if the product you make is unknown, has unknown safety?
But we have plenty of cannabinoids that have known safety. And
That is fair.
And they're completely acceptable to the Montana lawmakers. For example, Delta 8. So if someone wanted to follow 4B and make Delta 8, I think we cannot make the argument that Delta 8 is so toxic because the FDA hasn't approved that it's safe when we were selling it by the pound.
So are you saying that would make, does that make the state liable?
No, I'm saying that the state has already communicated to this council indirectly that they do not deem Delta 8 to be so toxic that it should not be consumed by Montana citizens.
I don't
So
know.
I don't see,
I don't know
well,
if that's what they stated.
well, we sell it.
They made it legal, but I don't know if they intended.
Well, that's my point. So if they decide to make Delta 8 derived from hemp legal, that would be the exact same decision and the exact same risk that they're taking with Delta 8 being consumed in the marijuana market. They've already communicated that they're willing to put that on the market because they don't deem it so toxic, even though the FDA hasn't weighed in and said it's safe.
Mhm.
So they have indicated that many of these cannabinoids are not too toxic to be consumed by adults in Montana. So I would have a concern that we would then have an even higher standard for Delta 8 that comes from hemp as opposed to Delta 8 that comes from marijuana. It's still the same chemical.
So I can get, so do you propose something outside of FDA?
Certainly, just like marijuana, which is done outside FDA as well. So
But it's not the same though, because it's synthetic versus natural.
that's,
And there's no
that's not really-
toxicology studies done on it. Like it's
there are no
changing.
toxicology studies done on Delta 8 in THC either. My point is, as a chemist, a chemical is a chemical no matter where it comes from. It can come from anywhere and it has the exact same toxicity. Now, if there are other things that get carried along with it, that's completely different. But the chemical itself, Delta 8, has the same toxicity no matter where you get it from Pfizer Laboratories, from the FDA, or as a prescription drug, or from hemp. It's still the same chemical, still the same toxicity to humans. And I'm not saying any of this should be legal, and I'm not saying that the lawmakers should pursue it. I'm just saying they directed us to advise them. And I don't like defying our lawmakers, frankly. I don't like substituting the judgment of the 8 of us for everybody who put this law out. That's probably the part that makes me the most uncomfortable.
We will
We're
definitely
not
address it.
lawmakers, I guess is what I'm saying. I
What
don't know that we
may-
should just punt.
We'll definitely address it. The intent here is not to punt. I want to settle any concerns about that.
Well, we were just
The-
getting ready to adjourn this committee with the exception of following up on definitions. So it did sound like we were trying to not
So
address.
we don't have to.
And if the consensus of the committee is simply that we don't want to touch it, then that's fine. I think we just need to memorialize that in a vote. And then that can be the committee recommendation. I won't vote that way, but that's how life works is committees make decisions. I just don't like that we are not really putting the effort into what the lawmakers said to do.
And so what we can do is, put the work into, putting forth guidelines. And if you feel strongly about not using FDA guidelines that already exist and doing something else, that's fine. But maybe at this point, it would be valid to take a vote and see, regardless of whether or not you can come up with a safe guideline.
Well, I don't want to come up with safe guidelines just to have you guys vote them down because it doesn't mean FDA. I would propose that if whatever the outcome of the vote is, if the vote is we're not going to propose guidelines because we think it should have to follow FDA, then somebody who agrees with that should write up the draft language saying we're not going to provide them. We think the FDA is the only way to go and that we shouldn't touch it. And then we can put that in the report.
Well, the other way we could do this is do a vote, see what people want to do, and if someone dissents, which it sounds like you may, then you can put your dissent in the report.
Right.
And that's fine too.
But I'm saying we need the other side to also consider, which is what I hear is the argument that we just need to say, no, we're not going to pursue this because it needs to be FDA. And then we can write that as well. Kind of what Andrew was saying as well. Putting both sides in and putting that in the report is great. I just don't like not addressing it.
No, and the intent's not to address it. This is an excellent conversation that should definitely be happening, and I'm happy it's happening. Just trying to understand, both, what you're trying to say, and my concern is just strictly with making sure that the products that we allow in Montana are safe. And just because you have a safe method of manufacturing does not necessarily mean the product is safe.
Completely agree.
Okay.
But I'm arguing that we already have products on the market that are cannabinoids and that the state lawmakers have deemed safe enough.
And
So am I saying? I know I'm being repetitive, but
Could there
we have
also be,
indications from the lawmakers. Pardon?
could there also be a third option where we can tell the legislator it's unclear what exactly they want us to advise on? Like, are they worried about safety, safe methods? Are it safe chemicals, safe, like, can we take it back to the legislator and ask them what is your intent with this, right? What we have to do here? I don't know. So
Yeah, I'm not sure. The letter of the law is what you go by. The theory being there that the legislators knew exactly what they were doing. Now that we've kind of talked about this a little bit more, I think that we probably are more on the same page than we think we are. That, yeah, let's give you the whole story, right, in the report. We'll give you, yes, there are guidelines for for the manufacturer of these products, while also being clear that there is no science on whether or not the synthetics are, particularly the novel synthetics, are safe for human consumption.
Completely agree on the novel. I don't think there's any way we could ever come up with a program that would include novel synthetics. I'm talking about the ones that are known to be in our marijuana products already. I think it's easy to argue that a completely novel chemical that's never been consumed can never be allowed to be sold in Montana until it's been proven safe. But I'm saying not all 60 or 100 cannabinoids fit in that category.
Then, I guess, for some additional conversation here, the other cannabinoids that, by default are kind of okay in our marijuana program, they're in such low concentrations anyways that there's been no research with high dose studies of those. Right, so CBG, CBC, all of these other cannabinoids that are natural, that are found in marijuana. If I'm understanding you correctly, you're saying that those should be assumed safe, but there's not been any research that I'm aware of that does any high dose studies of those.
Correct. So the easy way to control that would be the exact same way that lawmakers chose to control it with marijuana, which is set dosing limits.
Okay, but that's not what we're charged with.
No, but we're charged with exactly this. Recommended. If someone, let's say someone wants to take hemp and they have for whatever reason, they just hate Delta-9 and they don't want to put Delta-9 in their body. And they convert Delta-9 out or remove Delta-9 or do something that violates the rules that we are about to put forth for the definitions. We're saying they can't even take Delta-9 out by a chemical process to make it even less intoxicating so that they can get the other cannabinoids that are present there. They're not augmented, they're not created, they're not concentrated. They're just hemp, but with one of the intoxicants removed. I don't know that anybody wants to do it, but this would certainly, our definitions would preclude that from happening.
Yeah,
I wouldn't see that as a synthetic process. I mean, you could do that by separation. It wouldn't be a synthesis process.
Right. It wouldn't have to be, but it could be a synthesis process. Yeah, it would probably be easier and cheaper, but I don't know what.
It could be, but then analytically, you got to do chiral separation. I mean, what enantiomers are you getting? How do you know your enantiomer purity? There's all those complexities that
Correct.
like, you know, when it comes down to recommending guidelines, which is what we're tasked with, it says, you know, I would be, you know, I wonder if you're thinking of recommending something other than what an FDA process would look like.
Certainly. I would most want to mimic the marijuana program for dosing, for production, for concentration, for extraction, for sourcing of the material, all of that. It's already fairly well established. We would just need to add the specifics for whatever chemical we're talking about and whatever process we're talking about. It would just be adding one small additional layer. It wouldn't be coming up with a complete new program. And I agree that 99% of the cannabinoids would probably never be able to pass that muster, but it's, without looking into it, I can't believe we can all just say, absolutely, there's no single path that could have actually happened. That we're just throwing everything out because we don't see it for many of the more toxic ones.
Question from a non-chemist. Are there like a finite, smallish number of ways that you're aware of to synthesize these chemicals, and then are there like another like number of unsafe ways? Thinking about like, you know, bathtub gin.
Yeah.
You know,
Well,
like
yeah.
if we were going to make recommendations, and by we I mean you guys, because I'm kind of the facilitator here. If there are going to be recommendations on potential guidelines for safe methods, is that a small number of very particular chemistry processes, or is it, you know, a suite of things that people might do in their home kitchen?
Yeah, they would have a lot of choices of how to do it. That's for sure part of the problem. You could design 20 different ways to get to the same point.
But
And
would
most
they
of
all
those
result in similar purity and safety?
yeah, the safety would be exactly the same. The problem becomes if you have an uncontrolled process or a poor process, you could get additional things that come along with it, byproducts. Those are what are really the problem. If you make an inefficient way or an efficient way or a clean way to make what you're looking for, that's great. But if you bring along other things or create other things, that's where you really get into trouble. So we would have to make sure that those are simply excluded. And usually you do that with a specification, with a purity requirement, and with testing for byproducts.
Yeah, and
that's how the FDA does it, for example.
And that starts to make it, you know, kind of a worry report to EAC, but I think enumerating all of those things in as much gritty detail as possible would really, you know, behoove this whole process.
And in your example, an even easier way to get there, it's going to be much harder for anyone to take a bunch of chemicals off a shelf and get where they want to be in a way that I'm guessing the lawmakers would be happy with. It would be much simpler to extract from hemp, get CBD, isolate it, purify it, and then do one simple process to convert that into whatever desirable cannabinoid they have.
The only
And would take care of it, and dosing would take care of it, and byproducts and degradation products would
except
take care of the other concerns.
right now in the Montana Code and annotated 2023, the definition under hemp clearly states the term does not include synthetic cannabinoids. So the legislator already has determined any synthetics.
Where's that, Jonah? Sorry.
That's in the Montana Code annotated 2023, Title 80 under Agriculture, Chapter 18, Part 1 Hemp. You can actually easily find it if you go to the Montana Department of Agriculture website under Montana Rules and Code, hemp. So
yeah, so the definition of hemp in Montana has two parts. Part A, which we're all familiar with. Part B says the term does not include synthetic cannabinoids.
Right.
That's definitely saying.
Lawmakers wrote that, Montana lawmakers.
well, actually, it probably was written.
The bulk of the definition is federal that they just adopted. The rest is state.
So state lawmakers do have the authority to say that that would be allowed if they chose to. It's just right now they say you can't. That's my point, is We are telling the state lawmakers that they have to stop because they've written the laws that are currently on the books. It sounds to me like they're trying to explore the possibility of, is there any more room to bring something in? So to use past laws to supersede their instructions to us seems like the timing is wrong.
But then
They
you're
seem to
making,
want to explore the possibility of
isn't that an
Part
assumption?
B. Well, of course it is, but I'm basing it on the law signed by the governor. I'm not basing it on pulling MCAs or
No.
anything else from other parts of the regulations.
But you could,
They're the ones who chose to do this. We didn't choose to do it. I guess that's my,
yeah,
so I keep going back to, they're the ones who asked for it. It seems weird that we are running off into other areas and other House bills and other MCAs and arms to say, we think these lawmakers are wrong. That's kind of their decision. They have tons of legal staff that advise them. The governor has the attorney general. They've had plenty of legal advice as to whether or not this provision, this part 4, should be done. I don't like us substituting our judgment for theirs. And if it's 7-1, I'm perfectly fine with that. I just think we need to at least address it in the report and not just simply do the definitions and go on.
Yeah, I agree. It will be addressed. It won't just be overlooked. Most definitely. And as a chemist, yes, I agree. There's a way to make it in a safe way with high purity. I do worry about the safety of the end product because there's no testing, and that's where FDA comes in, and that's the process.
There is testing.
Their process, the FDA, their whole process of making these compounds include the safety of the consumer at the very end. So just like, I just keep going back to it, just because you can make it safely in high concentration or high purity doesn't mean the product's safe. And
I think it's safe to say we'd be opening Pandora's box to the legislator, so they're aware of it, if they want to go that route.
for me, if the safe way to do this would be to say very clearly, yeah, you can make this stuff safe, and reference the FDA and say this is the potential safe way to do this, while also ensuring that the product itself is safe.
Can't that be put down as the recommendation? That we're not ruling it out, but we require this or that, because you make a very valid point. And
It sounds like the consensus is everybody wants to go with the FDA route and not the route that's been taken with marijuana in the state. That wants to say the only safe way to take Delta 8 as my example is that it either has to come through marijuana as a secondary chemical or it has to go through the FDA.
for the purpose of our report, we're required to be one or the other, or can we give both options? Can we say we've discussed it and there are two things out there that are possibilities and let lawmakers decide? Is that possible? Then we can put them both out there with
Yeah.
Here are the paths that we're aware of.
And the FDA, so also in terms of like keeping it simple, right? FDA process already exists. Coming up with a state something process does not exist, would require a lot of would require multiple different agencies, would require statutory and rule updates, it would require a massive amount of money. And at the end, we are not the FDA, and we couldn't do the toxicological studies necessary to ensure that the end product is safe. That's my main concern. As a chemist in me, I totally understand that, yeah, you can make the stuff in high purities. There's no enforcement agency forcing people to do that. But as a person that wants to ensure that the consumer is protected, the only path forward I can really see is FDA.
So you believe that every substance in marijuana is proven to be safe by FDA level studies?
No, but I do think
don't
that the anecdotal evidence so far the thing that I do know is that, synthetics is killing people right now. That is something that is getting reported to fairs, and there is nothing like that with marijuana.
So which synthetics, Delta 8? Have there been any deaths from Delta 8?
Yes, for Delta 8 and Delta 10, which are the only two that you can
At the
report
concentrations
at
that are,
this
sorry,
time.
I didn't mean to interrupt.
So fairs is not set up very well to report all synthetic cannabinoids. Really, the only one, my understanding, is that they can sort of adequately track is Delta 8 and Delta 10. And thus far, there have been 53 deaths. General consensus is that it is vastly underreported. Marijuana, on the other hand, in reporting into fairs, has 0 deaths. And so, again, the big difference there, you have your synthetic bucket versus your natural bucket. And so, yes, marijuana, the main components in high concentrations are your Delta 9, your Delta 9 THC, some CBD, and very minute quantities of everything else. And so, yes, they're natural. They're kind of by default accepted into our marijuana program. But
what you mentioned has nothing to do with the toxicity of the cannabinoids. It has to do with the dosing. So if Delta 8 is toxic in that database because people are dying from it, it's not because they're taking it at doses that are in our THC products, our marijuana products right now. Right? It's because they're taking massive doses.
I don't know the answer to that question because
it's by definition, people would be dying from marijuana if Delta 8 is toxic at 1 part per million. And people are dying from taking Delta 8 at 1 part per million from the synthetic market. We know that to be true. It's not possible. It's either toxic or it's not. Or there could be
drug interactions that are happening. People are on some other pharmaceutical drugs and they take a low dose Delta 8 product. I don't know. I don't think it's just high dose scene. There's other things going on.
Question though. So if you were going to recommend a dosage, would it be no more than is found naturally in the marijuana plant?
It would be the easiest way to go, yeah. Because the state lawmakers have decided what we typically see in the marijuana industry is safe for our citizens.
Yeah.
I don't see
so
why making
just
synthetic,
kind of extrapolating from there, like to what industry would do with that information. That would crush any reason to produce it because it would be economically unviable to produce. I don't know what the numbers are, but that teensy bit of D8.
It's incredibly low. You actually have to have the right instrumentation to see that low to see it.
Yeah. So as a safety-minded person who I guess that makes me less nervous if your recommendation as a professional who knows a lot more about it than I do would be that if there was going to be a recommended safe limit, it would be no more than is found naturally in the plant, in the marijuana plant anyway.
Yeah, an example, like I'm not a big believer in like supplements in general, like just taking stuff because what's it gonna harm? You like it, but I've read a lot of stuff like one that I wasn't aware of was THCV. A lot of people think it has great physiological benefit to them. I don't buy it, but I don't have to. But if someone wants to take not marijuana because maybe they don't want to get high and they want to get some of these cannabinoids that they think are beneficial to them, I don't know why it would be so terrible that they couldn't have low doses of that without all of the intoxicating agents in it. And to get it from something like hemp, because it makes more sense to get it from hemp than it would from marijuana because you're throwing away 99% of the marijuana. Get it from hemp, do a simple process, get the one that you're interested in. I don't know why that would be considered synthetic.
So just thinking about what that would look, I'm sorry, I cut you off.
No, it's okay. Someone could choose to take what we consider a dose of THCV that may not be intoxicating at all, but may give them what they want. I don't know why they want it, but apparently people do.
Yeah, and your example has been D8, so I'm going to go with that. You're just, I think you've already answered this, but I'm going to say a different way. Your recommendation for a legal path to sell synthetically produced D8 would result in legal D8 products, new legal D8 products that are an infinitesimal fraction of the ones that are on the market now in terms of potency.
Right.
Okay, yeah, just trying to
Yeah,
clarify.
but
Just trying to clarify.
from
your
everything
point.
that I saw during the presentation you guys made for every meeting, everything out there seemed to be just black market. It wasn't intended to be something people would choose to take if they didn't want to get high. It was simply a way to skirt getting high laws, as opposed to
Yeah.
people who legitimately seem to want to have access to some cannabinoids, but maybe not at massive black market doses with no controls whatsoever on impurities and with bathtub production methods. So
Okay, so we're creeping up on 4 o'clock here. So how would the council like to proceed? We've thoroughly talked about definitions. Now we're going into part 4B here. Does anyone have a path forward that they'd like to go for this?
just to save time, I think it might be nice to just take a vote. And if people want to take the FDA route, someone who votes in that majority can simply write up a paragraph or however long you think it takes to
Yeah.
make that position, and then we can be done. I don't want to do a couple hundred hours worth of work to just have a kid at the end. So I think it would be smart to decide what the council wants to do before we chase paths that are not viable to the group as a whole.
Okay.
I don't know if we can take a quick vote because I don't know if we're fully understanding what we're voting on.
Yeah, I
So-
agree.
Hey,
I would also agree with not taking a vote, just because we've talked about it so much. I wasn't I'm listening, I'm not taking notes, and without having it all written out in front of me exactly what I'm voting on, I would feel a little uncomfortable voting after having listened to that. I don't know how, but as a non-chemist, I don't know about others, but I would feel a little uncomfortable voting right now without having it outlined in front of me, even bullet points, something.
Yeah, that's what I was just gonna ask. Eric, I don't want you to spend 100 hours to do it. I don't know that we need to meet, but if just a virtual meeting would even work. But just to kind of discuss it, we don't need to, I mean, we could hash on it over a couple of these meetings and probably still not come to
Yeah.
a full consensus here, but just a few thoughts either way of pros and cons.
So the two sides would be FDA route or come up with a Montana specific route. Is that what I'm understanding?
Except for the only caveat would be, yeah, that would be the two options. The only caveat would be, I don't really want to flesh out that second half. If in the end, everybody's kind of final bar is, even if we go this route, the end product is not proven safe to FDA standards, therefore we recommend you don't go that way.
Yeah.
But it's kind of a waste of my
And
time,
could,
frankly.
and could the third option to present both? That here are the two options as we see. You're the lawmakers. I know it sounds, one of the first things you said when you started making your point, and then it was that the lawmakers make the law, we make the recommendations, and at the same time, it seems like there's enough out there that is there a third path of, we've come into these two, here they are. These are the two paths you could take this, and maybe they want us to be a bit more specific, but it seems to me that there's enough conversation out there just amongst the committee that maybe isn't a clear-cut option. I don't know. I don't know the answer to that.
I will say that in preparation for myself to help facilitate this for y'all, I looked at a bunch of different advisory committee reports that have been made on various topics. And some of them do, Kathy mentioned earlier, having like a dissent section. That's absolutely an option. Some of them don't come to clear recommendations, and rather they list pros and cons and then just kind of foist it back on the legislature, because it, as I think has been noted here multiple times, ultimately it's their responsibility to come to a final decision. And the best thing y'all can do is give them the information to do that.
I hate to say it too, I don't think there's just two ways to do this. I mean, there's 2 million ways to do this, but there's two kind of currently accepted ways to do it. There's probably something that's merging the two together that it may cost a ton of money and the legislature may not go for it, but there's probably, I have my problems with the FDA, but currently that's the standard. When they went to a model of non-superiority, I really struggle with their decisions lately, but I think that there's probably a hybrid way to do it, but it's a tough ask, you're right. But I think we can lay out pros and cons of all of it. I don't think, I disagree with Eric. I understand where you're coming from, where they're asking us to make this decision. I don't think that's the case. But I understand where you're coming from. Me as in my profession, I have to go the one route because that's what's legal.
Right. No, it makes sense. There's no doubt that the FDA process would result in as safe a product as possible. I guess I refer to our state has put plenty of things on the market that have not gone through the FDA process. I mean, alcohol, cigarettes, and marijuana come to mind. I mean,
and they've also put stuff on and taken it back.
Yeah.
So
yeah,
just because they didn't know what they were approving.
Oregon's approved. Yeah. Oregon made everything legal and then made the mistake, but.
So maybe the best path forward is to do both sides and leave it up to the legislature. And if anyone feels strongly one way or the other, they can dissent. I guess so. How do you guys feel about having another meeting? Okay.
I don't think we all have to come.
Okay. So we'll have another meeting. We'll wrap this up, come up with a better game plan. There might be some voting involved. And yeah, and I don't want to put hundreds of hours worth of work on you, but maybe if you could come up with a general sort of a little more tangible idea for people to wrap our heads around, that might be helpful. So super high level, doesn't have to be granular. No need to spend a bunch of hours on that. And then we can regroup and discuss. And
is someone going to write the other side, probably the majority side, so that we would also be able to vote on that, or edit it like we have with the definitions?
Yeah. So I can draft that. It'll be basically, like you said, the FDA version of this.
Right. No, I understand that, and I respect everybody's decision on that. I just have a different take.
Yeah.
I think we should just put it in the report.
Yeah. So I can come prepared to the meeting with that. If you want to come prepared to the next meeting with the other version.
A super high level.
Yeah, that way you don't have to dedicate a ton of hours to it, but then as a council, we'll also have something that's a little more tangible to think about. And then we'll go from there. So we'll send out a poll and get another meeting scheduled up and go from there.
You guys, we've been doing about 6 weeks. Do you want to shoot for 6 weeks? Or are we getting to a point where we should get to this next one quicker? Because we all have there's kind of a specific thing to talk about, or should we shoot for
4 to 6 is fine.
Okay.
Summer's coming, it's gonna be a little harder to get everyone together, so
yeah.
might push it to 4 just
okay.
to get it full, so.
All right. Any dissent online? Should we do about 4 weeks? Sound all right?
Sounds good.
Sounds
All
good.
righty. You'll all see a poll in your email box.
Thanks everyone. Sorry we ran over a little bit.